become an example of how policy can perhaps find a way to flatten the curve, as they call it, with lesser and lesser cases being reported. Remember, the first cases of COVID-19 in India were from Kerala. So what is the formula that has been used by the state of Kerala? I have with me now Mr. Thomas Isaac, of course, the finance minister of the state of Kerala. Mr. Isaac, thank you so much for speaking with us. Let me begin by asking you very simply how Kerala seems to have, at this point, managed to flatten the curve.
Well, suppose we had failed to do that. I think I can only imagine what would have happened in the state. Suppose the number of cases were doubling every 4 days, as was the situation in the first weeks of March. By this weekend, or early next week, we would have had something like 50, 60,000 patients, of whom at least 1/3 would be critical, and far outnumbering the ICU beds that we can spare, and it would have been a calamity. Now that means it has not happened. Okay, it is not going to happen. The normal mathematical models, we have been doing that. It all shows where would have landed up. Our intervention has helped to diffuse this crisis and save so many lives. This is happening in India also in a smaller scale. In many states, numbers are not climbing exponentially, coming down. It's a positive thing. So it means that the way you intervene can have very positive impact, not laissez-faire attitude. We have to consciously intervene. Now, how did Kerala intervene? Just without taking too much time. One, we have a health system of which we are very proud, which is our historical legacy. I don't say it's my government creation. It's a historical legacy, which I think we are not doing enough in the rest of India. Every day, a public health system is being undermined, various schemes of insurance and so on. They're all good, but with the base of a public health system. That's one. Two, we were prepared. The moment you heard about the outbreak in China, well, alarm bells rang. We had our control room. We had groups in every district, mock drills, and so on. So we were ready when the Wuhan students returned. Not a single secondary infection from that influx. But then things got out of hand, the second stage. And because many people took it lightly and would dodge the restrictions and so on, finally we had a kind of doubt where we are going. As I told you, it was going up exponentially. Therefore, an intensive drive for tracing every contact of the patient for the last 2 weeks, testing every one of them, putting every one of them under observation. If anybody proves to be positive, once again, one more round, till, well, the chain is broken. And three is social distancing and, new styles of, the break the chain campaign. It was very successful. People adopted the campaign, and that also helped a lot. And I'd say, importantly, finally, we rolled out a relief program also. Let me a package for relief, putting money into the hands of people. And that with the local governments and so on. So these were the factors.
Mr. Thomas, if I may ask you, was it also helpful? Because if we look at some of the worst hit parts of the country, they happen to be the big crowded cities, Mumbai, Delhi. Was it also helpful that, there is no city like that intensely crowded in the state of Kerala, where there are such a large number of people living in close quarters?
No, Kerala has the highest density in India. And we call Kerala a big town. If you have traveled in Kerala, you must have understood the kind of settlement.
I mean, compared to a city like Mumbai, for example.
But nothing to
large, a slum like Dharavi.
But, there is no much difference between city and rural areas. It's a stretch, continuous, ribbon-like stretch of households. And therefore, we have to be very careful. It's not just one hotspot. Anywhere it can be there. So I don't think that was much of a difference. But is that there is a population that responds to what government says. And that's very, very important. That receptivity is much higher in Kerala. Let me say, the kind of synergy between the government policy and local initiative is very high in Kerala. And that helps. Government cannot go and stretch and watch every nook and corner of Kerala. But our local governments, organizations, and so on, they do help.
May I ask you what you see as the challenges coming up ahead? In different parts of the world, we have seen second waves coming. And is there a plan for a phased exit from the lockdown now and the end of 3rd of May? Because that will be the next big challenge.
Currently, we are facing two challenges. One is a planned exit to revive the economy. Two, we have to revive the economy while COVID still continues. COVID is not going to leave us. Our dreaded moment is that when lockdown is over, hundreds of thousands of persons are going to come back to Kerala. It is a homeland. And we have to provide for them, take care of them. Even if they're sick, they have to come back to Kerala. We'll take care of them. But the numbers are huge. Maybe 200, 300,000 persons. So we are preparing to quarantine them. Only 2.5 lakh beds have been identified in various places. They are being monitored and so on. And thirdly, in such a situation, large number of people are coming back and you don't know the morbidity among them. And then you are also opening up the economy. So what is a strategy at that time? We are going to follow a strategy of reverse quarantining. That is all the vulnerable sections above 60 who have special health conditions. That would come to, I think, something like 20% of our population. They would have to stay indoors, strict. They are indoors. Healthy people, even if they get contaminated, etc., they will go out to work. Okay. So we have to provide for this 20% who are staying in the house, their healthcare. Many of them would require food and special attention and so on and so forth. So we are preparing for this. I hope everybody, as you said, has noticed how we are flattening the curve. But I hope we will also be able to set an example. How do we exit from this lockdown? And that's the challenge.
Absolutely. That was the Kerala model that everyone is talking about.